Idaho's News Channel 7. This is the News at 6.
Welcome to the News at 6. I'm Morgan Romero. More and more parents are choosing not to vaccinate their kids, especially here in Idaho. That's according to a new report from the Centers for Disease Control and Prevention. News Channel 7's Hector Mendoza spoke to a local pediatrician about his concerns with these high exemption rates. Hector?
Well, Morgan, Dr. Michael Wheaton, a doctor at St. Alphonsus, says Idaho's exemption rates have been on the higher side for over the last 10 years, but now not nearly as high as they are now, which could impact the healthcare system. Vaccines.
They've been around for a long, long time.
A routine thing kids need before starting school.
They're very basic.
But more and more parents are choosing not to vaccinate their kids, especially here in Idaho.
It is kind of disappointing.
In a CDC report that came out last week, Idaho leads the country with a 12.1% exemption rate.
We have to understand that part of vaccination is to decrease the burden of these diseases on our population. And
Idaho is one of only 10 states in the U.S. with an exemption rate higher than 5%. Now, that number is important because the CDC says if the exemption rate is higher than 5%, it could increase the risk of outbreaks of vaccine-preventable diseases like polio and measles.
Recently, just this year, measles came back to the state of Idaho from an individual who went to another country where there was an outbreak. He was not vaccinated and he came back. And we had 10 cases of the measles.
And if that exemption rate continues to go up, pediatrician Dr. Michael Wheaton says it could put a strain on our healthcare system.
We saw it with the pandemic as we were trying to figure out the burden of COVID on our population. The same thing will eventually occur if less and less people vaccinate diseases such as measles.
According to the CDC report, before the pandemic, the exemption rate stayed within that recommended 5%, but during and after the pandemic, those numbers started to go up. Now, the report didn't go into detail on reasons for the increase, but Dr. Wheaton says the report reflects the growing concern about medicine in general.
Absolutely. I do think the pandemic really brought out some things that we didn't anticipate. I think we had information overload to the public. I think there was a greater spread of misinformation. We still are dealing with that misinformation, the concern that maybe we don't need vaccination, and really coming into the question, are these vaccines safe?
Dr. Wheaton says physicians in the state are doing everything they can to improve the vaccination rates.
We have a vaccine for children program that actually covers kids who are in the greatest need. The state of Idaho is very unique in that because of our immunization rates, we've opened that program up to all children. So there really is no vaccine cost.
Dr. Wheaton says even though the state is making efforts to get kids vaccinated, one issue is how easy it is to get an exemption in the state of Idaho. It's not only for medical or religious belief, but also for any philosophical reason. So Dr. Wheaton says, in other words, a parent can request an exemption simply just by choice. Morgan? Right.
We saw that play out during COVID, and so many of the vaccines you just talked about, Hector, have been around for a very, very long time. All right. I'll be curious to see what happens with that trend.